Despite being available to more Oklahomans than ever before, COVID-19 vaccination rates are continuing to slow down here, especially in rural areas where vaccine hesitancy is more pronounced. As of Wednesday, nearly 1.3 million Oklahomans are fully inoculated, about 32% of our state's total population. And as Rory Taylor reports, state health officials are now trying new ways to get the vaccines into hard-to-reach parts of our state.
My name is Brandie Combs. My title is Regional Director for District 5, which are the county health departments in Southwest Oklahoma.
While larger cities and counties like Tulsa and Oklahoma County have their own health departments, the State Department of Health manages large districts in rural parts of the state. District 5 reaches from the corner of the state up to Caddo County.
Our counties are very rural. Some counties, Harmon County, we're talking about one school district, and then you go to Caddo County and there are multiple school districts and the county's huge.
Combs says COVID vaccine uptake has differed from county to county, with interest varying in different zip codes and across time.
Overall, the response has been good, especially for that 65 and older population. We really had a good response, and we were giving anywhere from 5,000 to 9,000 shots a week whenever we first started giving vaccines, and it's definitely dropped off since then.
According to the CDC, as of April 10th, urban America is on average about 7% further along in vaccinations across all demographics. Part of that issue is that the U.S. government says roughly 80% of rural Americans are medically underserved, making the distribution of resources more challenging.
We know that our rural residents are just as, if not more likely to have chronic healthcare conditions. Some will be immunocompromised, they're getting treated for cancer. If you want to protect all those people, and you don't know if you're going to be one of them next year, quite frankly, or your child or your mom is, you want to get vaccinated.
Dr. Atul Grover is the executive director at the Research and Action Institute for the Association of American Medical Colleges. He says that the path forward for Oklahoma and the rest of the nation is flexibility.
If I go to OU's Health Science Center, I can say, here's 1,000 doses. They've got the storage facilities and they have the patient volumes. But as you get out to rural parts of Oklahoma and other smaller parts, suburban, exurban pieces of the United States, we're not going to be able to send 1,100 deep frozen doses out there. We need to be able to give people more flexibility.
That flexibility is more achievable with the vaccines now being offered to younger people.
As more adults are becoming vaccinated, children and adolescents are making up a greater proportion of COVID cases in the United States. Last week, they represented 24% of newly diagnosed cases nationally.
While children are generally more resilient to the virus, over 13,000 have been hospitalized and 127 have died of COVID-19 complications in the last year, making safety the most important, but certainly not the only, incentive for getting vaccinated.
So now if you have a fully vaccinated adolescent, 12 or older, and they are exposed, then they're not going to have to quarantine if they're fully vaccinated. So that's a huge incentive for kids to get vaccinated. It's also a huge incentive for coaches to encourage parents to consider getting their teens vaccinated, because last year the quarantining and the contact tracing was very disruptive to a school year, to a sports season, to academics, and we don't want that next year.
Similar to how local clinics have distributed flu shots at schools in the past, Oklahoma will be seeing plenty of COVID vaccine clinics at schools. Local doctors want to assure parents that vaccines are tested, constantly monitored, and safe.
The clinical trial data showed that the Pfizer vaccine was 100% effective at preventing COVID-19 in adolescents. Side effects were similar to what we've seen in older teens and young adults.
The model of bringing vaccine to schools for children is also effective for adults at work. In rural areas, as vaccine hesitancy settles in, driving to clinics during work hours adds an unnecessary layer of inconvenience.
I think we have to make this easier for employers. I really would urge them, for the long-term stability and productivity of your workforce, let your people have the time, paid time off to get vaccinated. I tend to ask people if they're vaccinated. One of the maintenance people I was talking to said, look, I work 8 to 5. The clinics aren't open during the week at that time. On the weekends, my wife works and we've got 4 children. and they're young. I can't just drag them around with me to a vaccination.
To meet that need, rural Oklahoma is shifting away from the pod model of vaccinations to smaller walk-up events.
We're trying to tailor these events, these vaccination events, around what is convenient for them. We're trying to tailor it so that there's no excuse if they want a vaccine that they can't get it. They're able to get it at any point in time.
We want to pretty much make everyone trip over us and say no before they have to seek us out to say yes. So we're at homeless shelters, farmers markets, every school district that'll allow us to come. We were at truck stops, casinos. We've gone pretty much anywhere we can think that people may be. All the festivals, the rattlesnake derbies and all the fun stuff. So anywhere there's people gathered, we're trying to make sure that the vaccine's available.
As those desiring immediate vaccinations get them, these walk-up models may become the norm across more urban areas as well. Rory Taylor, the Oklahoma News Report.